So the last thing we have to talk about now are washing rules. So in your skills book, for those of you who want to play along, remember that everything that I say in here, every lecture I give you, there is a page in the skills book that is going to illustrate what I'm talking about. So right now, this page that we're on is 80, and it's going to spread over to 81 as well. And again, if you see this little clapboard right here at the top of the page, that means I have a video on it. So you don't have to read all these words. You can watch the video. So we're going to talk about washing rules now. And this is a principle. One of the things that we need to understand about washing is that basins are no soap zones. Now, remember, if you can get a shower, you're going to go to the shower, you're going to turn the water on, you're going to get in, you're going to get wet, you'll apply some soap, you'll scrub a tub, you'll rinse that soap off, you'll get out, and you'll dry yourself, right? So when we're showering ourselves, the process is very, very simple, very linear. We all know what to do. It gets a little bit more complex, though, if the patient can't get to running water. And now we have to bring a basin of water to the patient. That increases the complexity a little bit. Because remember, we still have to go through all of those steps. We have to wet something, we have to wash it with soap, we have to rinse it with clear, clean water, and then we have to dry it. So if we're doing hand care, we're going to wet the hand, wash it, rinse it, and dry it. If we're doing foot care, we're going to wash it, rinse it, and dry it. If we're giving a partial bed bath, we're going to wash it and rinse it and dry it. That never, ever, ever changes. Those steps are always there. But if you put soap in the water, in the basin, you have lost the ability to rinse. You now have no clean, clear water to rinse with because your water's all soapy. You can't rinse with soapy water. So when we understand that soap cannot be added to the basin because we need that water to rinse with, that's a really big rule for washing. Basins are no soap zones. Now, some people say, well, can't you just use two basins? You know, if you get two basins, one with soapy water, one with clean water to rinse, that solves your problem. And yeah, it does. It solves the problem, but it increases the cost for the patient because every single thing that's used in a clinical facility, that stuff is not free. That patient will get a bill at the end of their stay for every single item used. And those basins cost on average $24 in a clinical setting. So can you imagine getting a $24 bill for something that you had no control over it? Nobody asked you, hey, do you mind if you get a $24 bill for this, right? Nobody consults you when you're the patient about cost. You get admitted, you get care, and then you get a bill. And you're expected to pay that bill. Sure, insurance might pick up some of it, but you're responsible for a certain percentage of it in copays. So you will get a bill. So why are we increasing the cost for a patient on something that we don't actually need to perform the skill? So that's the first part of this, is that there's a cost to the patient. But the second cost, or the second part of this, is the cost to you. Because if you've got two basins, that means now you've got twice as much to clean. So that's going to take twice as long at the end of the skill. And there's no need for it because you can accomplish the exact same thing with one basin by not putting soap in the water. So some of our washing rules include basins are no soap zones. Whatever we wash, we rinse, and whatever we rinse, we dry. Now, I want to talk to you about the patient experience. So I'm going to turn this off. And remember, you can view that on page 80 and 81 anytime you want to. But let me talk to you about the patient themselves. Because we tend to forget that patients are people, but they're people that are different than us. We are fully able, right? If you are not disabled because you're there to help other people, you are fully abled. But your patient, because they have us there, by very definition, they need help. That means that they are not fully abled. Now, this gets even more complex if they're older. Have you ever seen an older person's skin, their arms? As you get older, it seems like everything kind of shrinks and you end up with something that looks like skin over bone with big veins underneath. You can look at an older person's arm and actually see their veins running under. If you look at your arm, you probably can't see your veins all that well. That's because you have a layer of subcutaneous fat. It's a layer, subcutaneous fat under your skin. Now that does two very important things. Number one is it acts as a temperature regulator. Now, we have to understand, in order to understand this, that your normal temperature is 98.6 degrees. 98.6 degrees. Think about that. If you walked outside right now and it was 98.6 degrees, you're going to say, oh my gosh, it's hot, hot, super hot. Get me the AC. I'm dying here, right? It's hot. And yet you, right now, put your finger on your skin. You are 98.6 degrees hot as you sit right now. Well, air temperature is not 98.6 degrees. A comfortable room is probably somewhere around 75 degrees, actually. So if our body is 98.6 degrees and air temperature is 75 degrees, that means that we have to have a way of keeping us hotter than the environment we're in. That requires energy. When you eat food, your body burns that energy to create heat. And that heat keeps you at 98.6 degrees. We have to run at that time. If you cool down from that, if you get down to 93 degrees, you are dead. I mean, that's how specific this is, right? You can't go past 93 degrees without medical intervention. That's too cold. So we have to stay hot. We can't let this external air cool us down. So we need to understand that when you take in food, your body burns that food to create heat. Now, that layer of subcutaneous fat holds that heat in, kind of like a wetsuit. It keeps outside temperatures from cooling your inside down, and it keeps your inside temperatures from radiating out. So it keeps your body heat in and blocks out air temperature. Okay, so that layer of subcutaneous fat is so important, but it also provides a cushioning. So when you go outside and it's super cold, you feel cold, but that layer of fat actually helps insulate you from the true cold. Without that layer of body fat, you're going to feel that cold way more acutely. You would also feel heat more acutely. Okay, so that layer of body fat does two really important things. It holds your body heat in and blocks external temps from affecting you. It also provides a barrier between you and external temps. So it blocks your perception of how cold something is because it's not really truly penetrating. So what do you think happens when you lose that layer of external or that layer of subcutaneous fat? Well, that means that the body heat you produce radiates away. So your body has to work harder to keep at a consistent temperature. The temperature kind of falls a little bit, and you're not able to regulate your temperature as effectively. It also means that external temperatures are going to feel magnified. And you've probably already seen this. You just didn't realize it. Older people, a lot of times, if you ever walked into grandma's house and you're like, oh, grandma, it's hot in here. Turn on that AC. Man, it's like 78, 79 degrees in here. It's hot, right? And grandma's like, oh, no, it's fine. It's good. I'm good here. This is why most people retire to Florida, because they can't, and you ask them, they'll tell you, I can't handle the cold anymore. Just cannot handle that cold anymore. You might be in a facility and you are literally sweating because you are fully clothed and running around like a chicken with your head cut off, and every single little old person in a wheelchair has a sweater on and they're all like this, right? That's because they will interpret temperature way different than we do because they don't have that barrier. That external temperature perception is different than ours. Now, we need to understand this when we're going to bathe a patient, because when we put our hand in that shower water and we thought, oh, that's good, that patient is not going to interpret that temperature the same way we do. We might be in a shower room, again, sweating because, steam and stuff, and the patient might be just turning blue and shivering because the external temperatures affect them way more than us. So when it comes to temperature, your perception and the patient's perception, two totally different things. It might as well be Mars and Venus. They're two totally different things. So when we get water to bathe the patient, we need to be aware of this. We're going to check the water temperature with the inside of our wrist, because this is about as close as you can get to what your patient is going to experience. So just like a baby, you're going to check the water temperature with the inside of your wrist. It should feel warm, not hot, not cold. Now, if you're the type of person that likes your shower super steamy hot, that's you. Not everybody likes that. If you're like the person that likes a cool shower because you feel it refreshes you, that's you. Not everybody likes that. So take your preferences out of it. You're going to check the water. It should feel just warm, not hot, not cold, not your preferred temperature, just warm. Then you're going to fill the basin, and we're going to ask our patient to check the water. Guys, this is the most important step of washing rules. You have to get the patient to check the water. If they say it's too cold, change the water. If they say it's too hot, change the water. Do not argue with the patient. Do not try to convince them they're wrong. Do not say, you're crazy, I checked it, it's fine. Quit trying to make trouble. That is not what you should be doing here. You should ask them to check the water, and if they want it changed, you should happily change it, because they're not making stuff up. Their perception of temperature, way different than yours. And when you get to be older, it'll click. You'll be like, oh gosh, that teacher 40 years ago, I get it now. It's different. Their perception of temperature, way different than yours. So when we get water for a patient, we check it, and then we ask them to check it. Remember that we only need one basin, but we're not going to add soap. No soap zone. Whatever we wash, we rinse. Whatever we rinse, we dry. Those are washing rules. But let's go back to water real quick, and let's think about getting that water. So when in the process do we get water? Well, we have to do our opening. So knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today, and I'm here to do whatever the skill is, hand and nail care. Is that okay? I'm going to close your curtain, wash my hands, and then get my supplies. So we'll go get a barrier, put it on the table. We'll go get the supplies we need, put them on the table, and then we're going to get our basin. We'll take the basin over to the sink to get water, but our hands have been washed, and all we've touched are clean supplies. So we need to use a barrier, a paper towel, to turn that water on, because that faucet is not clean and our hands are. So there's another rule for washing rules that comes at the end. If we're going to apply lotion, we have to warm it up and then wipe off the excess. Now, years and years ago, when I went through training, we just threw the lotion bottle in the water, let it bob around, right? And that's how we considered it warming the lotion. But there's two big problems with that. Number one, that lotion bottle is not clean. It should not be in the water. We don't know what has touched it. So it's an infection control issue. But number two, even if the bottle is clean, we put it in the water, it bobs around for a few minutes, that is only going to warm up the outer surface of that lotion. The lotion that we squirt out is coming from the middle of that bottle, which means that the heat did not penetrate into that center area that we're squirting out. So if you grab a thing of lotion and you just squirt it on the patient's skin, it's gonna feel cold. And remember, elderly patients are gonna feel that temperature way more acutely than you would. So can you imagine super cold, somebody has just washed you with nice warm water. They've rinsed you with nice warm water. They dried you off. You're feeling really relaxed and good. And then all of a sudden, squirt, cold. Can you imagine how jarring that would be? That's not cool for the patient. Don't do that. So when we're applying lotion, you want to squirt it into your hands, rub it together to warm it up, and then apply it to the patient, the surface of the skin. But when you put lotion on, the surface of the skin can only absorb so much lotion, right? And then it's saturated. It just can't take in anymore. The cup is full. So anything that's left is just going to lay on the surface of the skin, and that makes it slippery. So if we're doing hand and nail care and we don't wipe off the excess lotion and they pick up a cup of hot coffee, it's going to slip out of their hand. If we're doing foot care and we put lotion on the foot and don't wipe off the excess and then put a sock and shoe over it, their foot can actually slip inside their sock, and that can cause them to fall. So when we put lotion on the surface of the skin anywhere in the body, we're going to warm it up first, and then we're going to wipe off the excess to prevent a safety hazard. So if we come back over here, you can see our washing rules right here in blue. You see that we have to have paper towel to turn the faucet on. We're only going to use warm water. We're going to check the water temperature and then allow the patient to check it. Whatever we wash, we rinse, we dry. Don't get the surface wet. And we talked about that on Monday, actually. Warm the lotion before use and apply, and then wipe off the excess. So we now know the washing rules, and we're going to put these in use for hand and nail care. Now, anytime we have washing, that means we have a basin that holds water, right? Because you have to have that for washing. So anytime we're washing, we also have basin cleaning. So these two actually go together. Sometimes you'll have basin cleaning without washing, like with mouth care, but anytime you have washing, you always have basin cleaning as well. So these two tend to go together. So as of right now, we know almost all of the principles that we have to learn. So see how easy that was? No stress, right? No stress.